What is adhesive capsulitis, frozen shoulder? Adhesive capsulitis is a condition characterized by significant pain, stiffness, and a loss of range of motion in the shoulder joint. The shoulder joint is enclosed in a flexible sac of connective tissue called the shoulder capsule. In a person with frozen shoulder, this capsule becomes inflamed, thick, and tight. Stiff bands of tissue called adhesions develop, and there is less synovial fluid to lubricate the joint. The result is that the shoulder joint freezes, severely restricting movement. The 3 stages of frozen shoulder. The condition typically progresses slowly through 3 distinct stages, each lasting for several months. Stage 1, freezing or painful stage. Duration, 2 to 9 months. Symptoms, a gradual onset of a dull, aching pain in the shoulder. The pain often worsens at night and with movement. As this stage progresses, the shoulder's range of motion starts to become noticeably limited. Stage 2, frozen, stiff stage. Duration 4 to 12 months. Symptoms, pain may actually begin to improve during this stage. However, the shoulder becomes significantly stiffer and the range of motion is dramatically reduced. Performing everyday activities like reaching overhead, fastening a bra, or reaching into a back pocket becomes very difficult or impossible. Stage 3, thawing or resolution stage. Duration 6 months to 2 years. Symptoms, the range of motion slowly begins to improve. The stiffness gradually subsides and strength returns as you are able to use the shoulder more. Full recovery can take a long time, but most people regain good functional motion. Causes and risk factors. The exact cause of frozen shoulder is not fully understood, but it's believed to be related to inflammation and scarring or fibrosis of the shoulder capsule. Key risk factors include age and sex. It most commonly affects people between the ages of 40 and 60, and it is more common in women. Immobility or reduced mobility. People who have had prolonged immobility of their shoulder are at higher risk. This can be due to rotator cuff injury, broken arm or clavicle, recovery from surgery, e.g. mastectomy or cardiac surgery, stroke, systemic diseases. Certain medical conditions are strongly associated with a higher risk of developing frozen shoulder. These include diabetes. This is the most common risk factor. People with diabetes are much more likely to develop frozen shoulder, and it is often more severe and harder to treat. Thyroid problems, both overactive and underactive thyroid, cardiovascular disease, Parkinson's disease. Diagnosis. A doctor can usually diagnose frozen shoulder based on a physical examination. Patient history. The doctor will ask about your symptoms and when they started. Physical exam. The doctor will test your range of motion. They will assess active range of motion. You move your shoulder yourself. Passive range of motion. The doctor moves your arm for you into various positions. In frozen shoulder, both active and passive range of motion are severely limited, which is a key diagnostic sign. Imaging tests. While not always necessary for diagnosis, they can be used to rule out other problems like arthritis or a rotator cuff tear. X-rays can show bone problems. MRI or ultrasound can reveal issues with soft tissues like the rotator cuff or the shoulder capsule itself. Treatment. The goal of treatment is to control pain and restore motion and function. Treatment is often a long process, and it works best when started during the freezing stage. Conservative or non-surgical treatments. Most cases of frozen shoulder improve with conservative methods. Physical therapy. This is the cornerstone of treatment. A physical therapist will guide you through stretching exercises to regain flexibility and increase the range of motion, strengthening exercises to rebuild strength once the pain and stiffness subside. Consistency is critical. Medications, over-the-counter pain relievers, NSAIDs like ibuprofen or Advil, Motrin, or Aleve can help reduce pain and inflammation. Prescription medications, stronger pain relievers or anti-inflammatory drugs may be prescribed if OTC options are not effective. Corticosteroid injections. A powerful anti-inflammatory medicine, like cortisone, is injected directly into the shoulder joint. This can significantly decrease pain and inflammation, making physical therapy more tolerable and effective. Hydrodilation or distension arthrography. In this procedure, a large volume of sterile fluid is injected into the shoulder joint to stretch and expand the joint capsule. This can help break up adhesions and improve the range of motion. More invasive procedures. If conservative treatments fail after 6 to 12 months, more aggressive options may be considered. Manipulation under anesthesia, or MUA. While you are asleep under general anesthesia, the doctor forcefully moves your shoulder through its full range of motion. This causes the tight capsule and scar tissue to stretch or tear, immediately increasing movement. Arthroscopic capsular release. This is a minimally invasive surgery. The surgeon makes small incisions around your shoulder and uses a tiny camera, an arthroscope, and instruments to cut through the tightened portions of the joint capsule. Home care. Follow your physical therapy plan. Do your prescribed exercises daily. Manage pain. Use ice or heat packs on your shoulder for 15 minutes at a time. Stay active wisely. Continue to use your shoulder for activities that don't cause sharp pain. Gentle movement is good. Forcing painful movements is not. When to see a doctor. Consult a healthcare professional if you experience persistent, unexplained shoulder pain and stiffness that limits your ability to perform daily activities. Early diagnosis and treatment can help prevent long-term disability and may shorten recovery time. Disclaimer: this information is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.